Good afternoon, Facebook family. We're back again. As you know, I'm Anthony Mingo. I've got the privilege to serve here at the Fairfax County Health Department. I've been working here with the health department for a couple years, working in community engagement. But previously, I've done a lot of work working with parents across the state in public health. Today, we have the extreme privilege to have Dr. Fabian Sandoval joining us today to talk about his fatherhood journey as a Hispanic father, but also to talk to us as a practitioner, as a doctor, to speak to us and give us some insights into not only what he does in his own family, but what he could also recommend to fathers that are out there listening to us today. So, welcome, Dr. Sandoval. We're just excited to have you. What we've been talking about is generational health and the roles that fathers can do and play in families to help transcend health across generations through our own individual modeling. Um, it's centered around really the four pillars: the physical health, the mental health, the emotional health, and the spiritual health. So just to kind of start, if you could give us a little bit about yourself, we would love to hear more about you and your father journey.
Sure. Well, thank you, Anthony. This has been quite an interesting growth part of my life. Becoming a father is there's no handbook for it, as you know. We all know there are books written out there, but everyone does it a little bit differently. And part of this is the joy of what it takes and what we learn as we go through, and the goods and the bads that we have seen growing up that we
Yeah.
also want to apply to our growing homes. So I know, Mingo, you and I have talked about what it's like to be a son, what it's like to be a father, and how we change these things around.
Yeah.
Um, we practice clinical trials medicine in our facility, and I have a little bit of a different perspective than my parents did, than my father has, when it comes to raising a young man to an adulthood state. So there's a lot of things that we can learn to do and to improve, so that we always want to make that next generation better than us.
Yeah, thank you, Dr. Zanoval. So, I was remiss, but I did want to let everybody know that you are the president and CEO of Emerson Clinical Research Institute, and many of you out there probably already know Dr. Sandoval from his series on Telemundo. Could you tell us a little bit about that, just really briefly, because we certainly
Sure.
want to help you there.
So yes, I've been very lucky and fortunate to have people believe in what we're doing here at our research institute, and we have a TV show that's been on air for going on 3 years now. It's called Tu Salud Tu Familia, Your Health, Your Family. I'm sitting here in part of this background that my co-host Dr. Audrey, who's a Hispanic mother and physician and partner in
Hmm.
this mission that we have to support community health. So here we have our TV show that is every Saturday morning on Telemundo in DC at 11:30, and we talk about health, all the health topics that have come up, from COVID to Alzheimer's to mental health,
Yeah.
cancer, you name it, we've talked about it, and there's always room for more. And our goal is to talk to our community in a basic term that we can all understand, remind them of an educated patient as a healthy patient, remind them when they can get services, talk to them about clinical trials, and remind them, more importantly, that our Hispanic community, as well as the African American community, needs to participate in clinical trials, because without them, the future of medicine won't evolve correctly.
Yes, thank you. And you mentioned mental health, and I know that's one of the pillars we'll get into. But I wanted to park on what you mentioned also is the aspects of our physical health. And if you could just share, just like from a father's perspective, how important that is in your own family construct, right? With your own son, how are you modeling physical health for your son?
Um, it's sometimes it can be a little challenging because of my work schedule, right?
Yeah.
I leave home by 6 a.m. I get home by 6:30 or 7 p.m. But there's always the weekends and there's always time in between.
Yeah.
And uh, because of technology nowadays, kids don't want to do a lot of stuff outside. They want to stay home and play with their devices all day long. And it
Mm.
becomes a very critical issue with hypertension, diabetes, and the mental health. Like we're going to touch on it later. But what I do is I really encourage him to go outside and do activities with me, right? Let's go outside. Let's go play. And he'll want to, we put him in soccer for a while. He's doing another camp right now just to get outside and do activities. And then we practice what he's learned. Um, I love to build things. So I make him do these activities as well, which is, we're building a playground for him and we're doing it together. It's going outside and doing that type of exercise so I make him think. There's critical thinking involved. There's, hand-eye coordination involved. There's a little bit of lifting involved. And doing that really has helped. Getting on the bike and going for a bike ride. Staying outside is really important. And that's how I'm encouraging that at home.
Yeah, and I think there's another real benefit to that that many fathers out there need to hear is that when you are creating these experiences with your son, hands-on, doing it together, you're also creating wonderful memories, and those memories will help drive these behaviors when he has his children one day. So.
Mm-hmm.
As another father, I appreciate because that's what really a really important thing that's missed by most fathers, particularly those of us that are very busy, right? So we have to optimize the time that we spend with our children, but we also need to recognize fathers out there that there's real benefits. We're building memories for our children
Yeah,
as well.
and
So
and we do. I've always wanted to do stuff that I couldn't do with my dad, right? Which is dedicated time for me, right? I
yeah,
wanted to spend time with my dad, and he was too busy. So
yeah,
we have, Emerson Daddy Day, right? So we'll do stuff just he and I,
yeah.
and we love to go to the theme park. So we'll go at least once a year at the beginning of the summer. We have Emerson Daddy Day at King's Dominion. And
Wow,
it's just him
wow.
and I, no moms, no nothing, just he and I, and just do all the things that we want to do. And that's exercise because we walk around a lot and we play and giggle and have a great time.
Yeah, no, that's awesome. Our presence is really, really important to pour into our children. Great pictures, by the way. I love that
Yeah.
picture there. Um, so as we're looking at our children, and certainly we play a role in their physical makeup, as I mentioned around those pillars. But we also sometimes those of us that are really busy and time constrained, we may get stressed, right? And sometimes inadvertently we may bring stress home. Could you give some words of encouragement to fathers around the importance of mental health and
Hmm.
emotional health, the cousin to and how important that is to keep sort of that in perspective as well.
Well, during our stressful times that we have, it is important for us to vent, de-stress before we get home, right? And that is just the drive time home for me. It's going home. It's the time to listen to the music that I want to listen to, call the people I want to call to, roll down my windows, sing, let it all out, cry, do whatever we have to do. So when we get home, we don't dump that on our kids.
Yeah,
It's not their fault that we're having a bad day. It's not their fault that we got hurt at work. Do not take it out on them because we were kids too, and we will remember those moments when our dads, our Hispanic parents can be very physical. We love, you know, to give the hand, to slap them on the butt, to say this is how we would, corporal punishment attitude. We cannot do those things. The children are there to love us unconditionally, and we need to realize that. And we may not receive this as soon as we walk in the door because they haven't seen us all day. So we need to warm up back with our child and give
mm,
that one child or all the children that love that they're waiting for us to give them. And don't bring the stresses of life into those special bonding moments that we have when we get home. And
excellent. And
develop routines, Mingo. Develop routines with our kids. My routine with my son is I'm the one who gives them helps them into bedtime, shower, brushing their teeth, and pajama time. That's my time that I can at least devote to him.
Excellent, and that's great advice around developing routines because no matter how busy we are, right, there are things that we could do to contribute as well to the raising of our children. Presence, as we talk about, are much better than presents that we may choose to build our,
Mhm.
or to buy our children.
Yeah,
I
don't
Yep,
come home. I mean, it's good to go
yep,
home with a small present or a small little treat every once in a while, like the picture
right,
that I just showed you, right? We go get
right,
a sundae, but
yep,
it can't become that normal habit
that's
because
right,
then we're teaching bad habits of
yep,
dad's home, where's my candy bar? Dad's home, where's
right,
my treat? That's not, it should be dad's home, where's my hug? Where's my
yeah,
kiss? Right?
yeah.
And I do
Yeah.
say that at home all the time. It's like, I brought you something. And he's like, what, daddy? I said, I brought you a kiss. And he's like, he rolls his eyes now because that's my standard go to. I brought you something. I stick my hands in my pocket. I said, I brought you something. He goes, not a kiss. I'm like, no, it's not a kiss. It's a smooch. Right. So it's a hug. So
Yeah,
he now laughs and he just rolls his eyes, but it's something that we need to always do. It's bring those things. And then we can talk about the other connections, which is your other pillar, which is also spirituality,
yeah.
right? We pray together every night, and we are a mixed family. My wife is a white lady from Texas, right? I bring in my part of the Latino side of me, and we pray in Spanish, right?
Wonderful.
He and I pray in Spanish, and we have that time that's just he and I because we need to develop that part as well.
Yeah. No, I appreciate that, and I love
That's
what you.
actually right after church, as a matter of fact. That picture that
Oh,
you're
I love
showing.
that. That's a great
Right?
picture.
So
Oh,
perfect
I love
timing.
that.
Yeah.
Yeah. Wonderful, wonderful picture. And I appreciate you saying that because it's again what I heard is that you're instilling in him the confidence not only to walk in his place of manhood one day, but you're also instilling his cultural value in him, even though he's coming from as you mentioned, your wife is not of Hispanic origin, but you are making sure that he also can identify in what his makeup really is in both, right? So that's awesome, and
Mhm.
bless you for that. So just in terms of a putting your doctor's hat on, we have a few minutes left, and again, I just appreciate so much the work that you are currently doing with Emerson Clinical Research Institute. I also know about the foundation, Emerson Diversity Health Foundation. Want to mention that as well. But and then look, I just want to remind everybody to please check Dr. Sandoval out on his Telemundo show. You want to say the name again, please, sir?
So called Tu Salud Tu Familia.
Yes.
And with the website for the TV show is the same thing, tusaludtufamilia.com. On
Thank you.
YouTube, they can find us the exact same way. On Facebook, they can find us the exact same way. And there's a lot of information. And if you wanted to watch it in Spanish, great. If you wanted to watch it in English, go YouTube. You can actually put subtitles on it. So you can watch all the different health topics that we discuss. It's very entertaining and it's very lively and it gets a lot across. But the doctor hat on, Mingo, I think it's important for us to set the example,
Mm,
set the healthy example.
yeah.
Eat as a family, eat proper foods, eat nutritional meals. Don't, the examples are so important of what we eat because what we eat is what our kids are going to eat. And you can see that when you go out into the community and you see one thin parent, one thin mom, and a thin child, one obese parent, obese parents, and obese children following behind them.
Yeah.
Now, there's also something to be said about the finances of it. Sometimes it's expensive to eat healthy.
Yeah.
It's cheap to buy a $5 pizza and feed your family because that's all you can afford because poverty levels are something to consider. But there's
Yeah.
also ways that we can try to come up with somewhat healthier options of cooking at home, teaching our children how to cook healthy and eating healthy and stop eating all that junk food and stop drinking soda. Something
Yeah.
as simple as drinking soda is going to take your family a long way. So the doctor hat says that all the time, and I practice what I preach when it comes to that.
Yeah, Dr. Sandoval, thank you for this. And one of the things I often tell fathers around healthy eating, because you are spot on, eating healthy, particularly in our communities of color, communities that are low income communities, that it is expensive, and oftentimes you may have to deal with the dollar menu or getting a pizza. But what I encourage fathers to do is to pick one day a week and just start there. Oftentimes fathers take things in bites. So I don't, any advice around that is just take one day and at least start there. And I think what happens over time, you'll start eating increasingly more healthy over time. As we end, is there anything else that you would want to share with our viewers today?
Mingo, I think it's important for us men to remember that uh, being a father is a big honor and it's a big privilege, and we have to keep those little days in mind. And a lot of people wish they could be fathers, and those that can't wish they were in our shoes. And when we're in those shoes and you get frustrated, stop. There's no reason to be frustrated. It's part of the joy. It's part of those memories that you
Yep.
mentioned before.
Yep.
So many men wish they could be a father, and be a good father. Be a good role model.
Yeah.
Uh, don't bring violence into the home. Don't bring violence to your children's life. Make time, because if you don't make time, you're going to be sorry that you weren't a part of that. And then when your child is a man, he will and should be able to say, thanks to my dad I learned this. Not,
Yeah.
and it's a positive thing. Not, thanks to my dad I watched my dad beat my mom and now I beat my wife.
Yeah.
That's
Yeah.
not what we want to do. We want to set the best examples for our children.
Yeah, yeah. Thank you, Dr. Sandoval. Fathers out there, I thank you for watching. Again, we'll have Dr. Sandoval come back, but please check him
Absolutely.
out on the web, on YouTube, and watch his show on Telemundo. But I also want to leave you with this, and I say this every week. It's really important for fathers to understand that you don't have to do this job by yourself. There are many of us out there that are like Dr. Sandoval, myself, that will gladly come alongside you, and just find a network of other fathers, and have these types of conversations. You'll be amazed on what kind of good things that will bring back into not only your life but into your children's lives. So with that, we thank you, and everybody have a wonderful day. Thank you, Dr. Sandoval.
Thanks, Mingo.
All right, take care.